Devastating images out of India in the past few weeks paint the picture of a country overrun by COVID-19. It's an abrupt turnaround that sees daily case counts in the hundreds of thousands. With us now on what happened and whether things are headed in a better direction, we welcome in New Delhi, India, Barkha Dutt, columnist for the Washington Post and editor of the news portal Mojo. And here in Ontario's capital city, Dr. Anna Banerji, infectious disease specialist and director of global and Indigenous health at the University of Toronto's Faculty of Medicine. And as I welcome both of you to our program tonight, I want to just start with a personal word to you, Barkha. You lost your father to COVID-19 a few weeks ago, and you shared this on social media at the time. The kindest, loveliest man I have ever known, my father Speedy, lost the COVID battle and died this morning. When I took him to hospital against his will, I promised I would bring him home in 2 days. I couldn't keep my word. I failed. He never broke a promise he made to us. Barkha, first and foremost, our condolences on your loss. This must obviously be a horrible time for you and your family, and we're hoping that by sharing the story of your father's circumstances, we can help to tell India's story and have everybody learn a bit more about what's going on and the gravity of the crisis in India. Can we start just by having you tell us what did happen to your dad?
Thank you, Steve. And yes, I think one of the reasons that I do want to talk about my father is because in the telling of his story, I'm also telling the story of my country. The irony, of course, is that as a journalist, I've been reporting nothing but the COVID pandemic for the last 15 months from across India. And to quite literally become the story that I had reported has been surreal and devastating and heartbreaking. My dad, like everybody else, started off with a mild infection, and the doctors thought he could be managed at home. And for 1 week, he seemed to be doing absolutely okay. In fact, I was out in the hinterland reporting the COVID crisis, even as my father had tested positive, because the doctors felt that it was manageable and I didn't need to worry. But after a week, his situation just nosedived. He had other comorbidities. He was diabetic. He was in his early 80s. By the way, he'd had one jab. The reason this is relevant is I'm haunted by questions about, the if and when of India's vaccine rollout. Had those vaccines rolled out quicker, had I managed to get him 2 jabs in time, maybe he'd still be alive today. But what happened was this, that when the doctors finally said, look, you've got to get him to hospital, the health system here has been overrun. It's been overstretched. Every resource is wanting, even for people with relative privilege and access to resources like me. So I organized a private ambulance thinking it would be quicker to rush him to hospital. And I made what I think is possibly a fatal error. What arrived was actually a rickety old car repurposed as an ambulance. It had no paramedics. It had a crew of 1, which was the driver, and it had a single oxygen cylinder at the back. I panicked a bit at seeing this, and I asked the driver repeatedly, does your cylinder work? And he assured me that it did. So because I was panicked and wanting to get my dad in time to the hospital, and the hospital ambulance would have taken another few hours because that's how overburdened the hospital was, I put my dad onto the back of the seat. There wasn't even a stretcher. I jumped onto the front seat and I rode with him, by the way, through traffic snarls. One of the big gaps in our cities is we still don't have a green corridor for ambulances. And by the time we reached hospital, unfortunately, the cylinder had not administered the high flow oxygen in the way that it should have. And his oxygen levels plummeted. He had to be taken straight into ICU and he never made it back. He lasted 5 days and 2 of those were on ventilator. What I want to say is, through all my heartbreak, through all the trauma of that ambulance, through the fact that I will be shadowed by guilt as to why I took that non-ambulance ambulance, my father had a fighting chance at living. He got excellent medical care when he finally got it. But most people I have been reporting on did not even get into the insides of hospitals. Or if they got into the insides of hospitals, they died not from COVID, but from oxygen supply running out to these hospitals because oxygen ran short. So I am aware in this moment of personal heartbreak, and it's a strange thing to say, that my father was luckier than most. He didn't make it alive, so he was deeply unlucky. But in having that chance at living, he had a chance that hundreds of thousands of Indians did not or have not been getting.
Barkha, before I ask you a follow-up question, and this may not be my place to say this kind of thing, but I feel I should anyway. You did the best you could under the circumstances, in my view. You gave your father a fighting chance. In my view, you did what every kid, you did your job. And I'm sure you feel guilty, but you shouldn't. You did what you could under the circumstances, given a once in a lifetime set of crazy circumstances. So I just put that on the record for what it's
Thank
worth,
you.
which is probably nothing, but I believe it in my heart.
Thank you.
Um, and now here's the follow-up question. You yourself got COVID as well. How are you doing?
So it was really weird. Like I tested positive the day we cremated my dad. The cremation was another saga. Cremation grounds in India have been overrun. There isn't enough space to cremate our dead. When we reached the crematorium, we had to go to the ones closest to the hospital. We found that there was a scrum for space, and people were like quarreling amongst themselves. This is my scheduled slot. This is my scheduled slot. Eventually, a nasty little argument erupted between the families. My sister and I had to call the local police. The police eventually turned up and helped us cremate our dad. And that very day, I tested positive. And so for me, I think it was the moving pieces of grief and sickness, and then just the rage I felt as a journalist at everything happening around me. I found it very difficult to process all of it together. And the only way I could do it was by continuing somehow to work. So I spent about 14 days in my basement studio where I am right now, in isolation, but trying to do my shows. And the moment I was able to test negative, I hit the road and went back on the reporting journey through the rural hinterland of India, because I could not think of any other way to make sense of my father's death. And also, I guess, as a journalist, I could not think of any other way um, to make relevance of my own grief.
Totally understand. All right, let's share, because we have a significant Indian population of emigres and a longstanding Indian community in Canada, particularly in the capital city of the province of Ontario, Toronto. And I'm going to ask Tony if you would bring these numbers up right now, because we want to compare the COVID crisis in India and in Canada. Two very different countries in many ways. The first, and most obviously in terms of population, India is a country with north of 1 billion people, Canada not even 38 million. The percentage of the population vaccinated in India is just over 12%. In Canada, 40% of us have had our first shot anyway. Doses given in India, 175 million. In Canada, 15 million. COVID cases by the millions in India, 24 million. We're just over 1 million here. And COVID deaths in India, 274,000. In Canada, short of 25,000. Dr. Banerji, I want to get you and your expertise in here at this point. As you look at that chart and you make those comparisons, what's the story that jumps out at you?
The lack of vaccination of the general population, even though there's been 100 and I think 75 million people with a population of 1.4 billion, they really haven't gotten the vaccine as widespread as they could. I just want to say before I continue that for Barkha, this was not your fault. You know, my aunt and my uncle both died in India out of from COVID this year, and it's not you, it's not the ambulance, it was not the lack of oxygen. COVID is a ravaging disease, and it basically can destroy people's lungs. So even if he had the oxygen, he probably wouldn't have survived. And there's nothing you could have done to make a difference. So don't feel guilty. I think you did the best you could as a daughter. So I just wanted to put that out there.
And you know what? That's a professional speaking, not just a TV host like me. So take it from her, if not from me, Barkha.
Yeah, I, I,
Anyways,
I
no,
will. I will, and I'll try to feel better. Thank you.
good, good. Dr. Banerjee, follow-up question here. There's now reports of a triple mutant COVID variant from India. I wonder if you could tell us, in your judgment, how that compares to the other variants of concern we've heard about, which originated in places like the UK, Brazil, South Africa, etc.
So, as the virus multiplies, every now and then it has mutations. And a lot of these mutations make the virus not so hardy and they die off. But when a virus has mutations and it makes it sturdier, it tends to survive. So How does this compare? Is it more severe? Is it more infectious? We really don't know, but it sounds like it possibly could be. And that's one of the reasons, on top of multiple other reasons, why the outbreak is so devastating right now in India.
Barkha, you're on the ground in India, so let me ask you this next question. We had been reading for quite a long time very encouraging headlines coming out of India saying that India was on top of this situation. And then suddenly it became the worst country in the world in which to have COVID-19. What happened?
I think what happened was a combination of complacency, callousness, ignorance, and the lack of preparation. Definitely, the first wave of COVID in 2020 was mysteriously gentle on India, especially in terms of fatalities. And those scientists kept warning of a second wave. I think somewhere the complacency that emerged from how the first wave had gone for India set in at the highest levels of government. And contingency plans were not put in, which is why we saw these desperate scenes where oxygen ran short, where our places of worship, our Sikh places of worship, our gurdwaras converted their langars, which are usually the banquets of free food that they give away, into feasts of oxygen, quite literally lining up oxygen cylinders outside places of worship so that people could come uh, and get an oxygen mask for about 30 minutes and get like literally a new lease of life, at least for that day. Those are the kind of scenes we've been seeing. Now, what happened was two, three things. The government ignored the warnings that scientists were giving it about a lethal second wave. The government did not purchase enough vaccines. Instead, we decided to use vaccine as soft power and export and gift away vaccines before we had enough for our own people. Now we have a really horrific vaccine crunch. And most egregiously of all, through this pandemic, we kept continuing mass gatherings, political gatherings as elections continue to take place, as well as religious gatherings. It was only in the third week of April that the Prime Minister himself suspended his election campaigns. And till that point, it was almost as if there was mass denial. And lastly, we have seen multiple institutions of governance fail. We have seen our health workers betrayed by a monumental failure of policy. And, I'll tell you what one doctor told me. He said he felt he'd been sent in to fight a nuclear war with a stick.
Hmm. Now, we saw in our chart earlier that 274,000 people in India have died already. And I want to ask you, based on your knowledge of what's going on the ground, do you have reason to believe that's not the whole story?
Oh, I have more than reason to believe. I have personal documentation of evidence that will tell you that those numbers, the gap between the official numbers and the actual numbers, I initially thought were off by a factor of 4. I have now begun to believe that they could be off by a factor of at least 8 to 10. And let me give you a few reasons for why I think this. One, simply, if you were to visit the burial grounds and the cremation grounds and compare, literally pick up any one part of India and you see how many pyres burn or how many bodies are buried, and you compare it to the official data that is released by that particular district or that neighborhood on that day or in that week, you will see a manifold gap. The second thing that is happening is that as I have traveled through rural India, we have seen ghastly images of corpses floating in our rivers. There has been a mass dumping. We don't know if it's been from the stigma of COVID, which continues to exist in our villages, or whether it's because poor people are literally running short of money to cremate their dead. But we have seen a mass dumping of bodies that are fetching up on river shores, bodies that are being left unidentified and abandoned in shallow graves on barren riverbanks. I have personally traveled to 5 such places in India's most populous state, Uttar Pradesh, and counted up to 1,000 bodies buried in the sand myself. And finally, we have met people in villages where people are not even getting to hospital. So you have entire villages saying that we've seen a sudden surge in deaths. People never got to hospital. They were ill for 3 days and they died. There is no documentation of COVID on their death certificate. But all of this adds up to a large mass of either deaths that are never reported as COVID, or are being undercounted, or are just not being registered as anything. They're just abandoned bodies. So I think we may never actually fully know the scale of how many Indians are dying from COVID.
Hmm. Dr. Banerji, we in Canada are, of course, hoping to vaccinate our way out of this problem. We have a relatively small population. We seem to be making good progress on making that happen. But with a population as vast as India's, 1.3, 1.4 billion people, can you take the same approach and be successful that way, in your view?
Well, outbreaks occur when there's not enough susceptible people for the virus to spread. So people become immune either through infection or through vaccination. And unfortunately, a lot of people in India, I believe, have been infected, and I agree that the count is probably tenfold of what they're registering. And so, but I think really the way that India needs to move forward, again, a lot of people are probably immune now for a while because they've had COVID. It's through vaccination. I think the world needs to get together on this and support India in having mass immunization strategies all across India.
Well, that was going to be my next question. If the international community responded, how should they respond? And would the Indian government be open to that?
Oh, I have no idea if the Indian government would be open to that, but Canadians should, well, the world should get together and help. What we've learned is that, when viruses are out of control, there's more likelihood of having mutations, and when there's mutations, eventually it will spread. And so what's happening in India eventually will affect all of us. And so, donations of vaccine, donation of money, to reputable organizations when we know that the money is going to get to where it needs to get to. Our government, if we can get money to the Canadian government, and Canada, sends money and resources to India, I think the whole world needs to help in this crisis.
Barkha, do you know whether or not the Indian government has asked for help or would be open to help from the outside world?
I think the government would definitely be open now after having goofed up on chasing a kind of vaccine nationalism and getting obsessed with the idea of an India-made vaccine, which I think was another fatal error that we made. But I think we recognize that we need vaccines. Our vaccination rate is down by 41% at the time that I'm speaking to you. At a time when at these numbers, it will take somebody to the math more than 2 years to vaccinate 75% of the population. We do not have that time. That is the truth. And I think we need as many vaccines as we can get. So I think whichever part of the world has more vaccines than they needs to turn its attention to India. We do need vaccines urgently. And there is some legal question, I know, between the government and, let's say, companies like Pfizer over indemnity. But what's happened is that the Indian states have now been freed to float their own global tenders. So basically, every state in India is free to buy vaccines from the world and is ready to spend that money. We just need those vaccines. We don't necessarily need them gifted. We just need them urgently.
Dr. Banerji, I alluded to the fact earlier that we have a significant Indian population here in Canada, and I wonder how the diaspora, to the best of your knowledge, is reacting to this news from overseas.
Well, for many, many people in the diaspora, they've been touched by someone who's sick with COVID or who's died. Like I said, on my mother's side, my mother's older sister and younger brother have died of COVID. So I think most people know someone in their family or friends that have died. And so I think it's watching what's happening is very upsetting, and you feel helpless in a way. But I think that, if people can get together, I know their organizations have raised money, raised funds, sending, helping to send equipment. I think that, there's Indians all around the world. It's a huge diaspora of Indian people. And again, if Indians and non-Indians get together and try to support India get through this crisis, I think that's what we need to do.
And a follow-up, if I can, and I'm really trying hard when I ask this question not to bring politics into it, but you can't help but notice that there are television commercials that have been taken out by the Ontario Progressive Conservative Party, Doug Ford's party, obviously, Premier Ford's party, urging Justin Trudeau, the Prime Minister, to tighten up the borders because he says, in his view, there are too many cases. Well, what's the line he used? COVID's it's not swimming over here by itself, is the line he uses. It comes on airplanes. Now, you're an infectious disease specialist. Do we have a problem with a porous border and, say, flights from India bringing COVID-19 to Canada, to Ontario at the moment?
Any kind of flight coming into Canada or any international flight allows viruses to spread. So it's not just flights coming into India, it's other parts of the world that have hotspots, but also flights often don't come directly from India. They come through Europe, or they might come through Africa. So unless you're willing to stop all international travel, which is what we should be doing, stopping all non-essential travel, it's hard to make a difference with just stopping flights to India. And most of the transmission occurring in Ontario is really people who are essential workers, people who are being exposed to COVID through the work that they're doing. And so we need to address that. We need to address unpaid, paid sick leave. Those are issues that, and trying to keep sick people home, those are the issues that we need to address in Ontario. It's not so much the borders, but again, if we're closing, we should be closing all international flights, basically all non-essential flights from around the world, not specifically targeting India.
All right, that's the Canadian response. How about Barkha, back to you for what could happen in India? 14 months ago, we know that Prime Minister Modi called for national lockdown. Do you think the possibility of that happening again now is in the cards?
Well, I know that experts are calling for one, but the government hasn't gone that route this time because it had so many disastrous economic consequences the last time. And also, a national lockdown without vaccines to accompany it is almost pointless. It would, of course, serve in limiting the transmission. So, what's happened instead is that most states are pursuing their own lockdowns. So, instead of one big meta lockdown, you have a series of multiple lockdowns, which is probably achieving the same impact. I think at the moment, what we are looking for desperately is vaccines. There is no other way for us out of the second wave. In fact, vaccines may not be a way out either because they're in such short supply. And in any case, a vaccine to be effective does take between 6 to 8 weeks. So even if let's say you had a ratcheted up set of vaccine doses being administered right now, it wouldn't actually necessarily contain mortality in this second wave. So we're in a very, very dire situation. And I just wanted to say one thing on the borders. Like, I know every country has to protect itself, but you can shut borders only so far and for so long. Eventually, this is a virus that will find its way, not just under doors and through the air, but, across borders in one way or the other. So we need for all of us to be safe, And that's why I keep saying that if India doesn't move your conscience at this point, then let it move your self-interest, because with this big mass of humanity, the large denominators that we're seeing infected here, eventually this will touch the world. So it is in the world's interest somehow to help us.
Well said. Barkha Dutt and Dr. Anna Banerji, we are so grateful to both of you for coming on to TVO tonight and sharing your wisdom on what is the most important COVID story in the world today. Barkha, once again, our condolences on the loss of your father, and we urge both of you to stay safe and be well.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.